So hello everyone. Today my name is Klaus Müller. Today I'm going to give a talk on how to use demographic pattern analysis to predict COVID-19 fatalities on the US county level. It's work I've been doing with my startup company, KO LLC, and also in collaboration with Computer Science Department at Stony Brook University. So let's speak about this first. The virus, SARS-CoV-2 is the virus, and you'll see this artistic rendering on the left that probably everyone's been tired to see at this point. Probably everyone has seen this now. This is actually a microscopic image of the virus, and this is the actual drawing of the virus, how it actually works. Okay, the illustration of this virus. Formerly it was called 2019 nCoV, novel coronavirus, but I guess it's no longer novel, so people don't call it anymore. And really what it is, it's essentially RNA enveloped with these proteins around, and the very vicious one is this S protein, the spike protein, which is an antigen, which actually links to your cells and penetrates it, and there's other proteins involved in here. But really this RNA is the one that gets deployed and multiplied into new viruses, and then it takes over your entire system. So how does this work? Okay, so the way it works, basically the coronavirus latches onto the cell, okay, and then penetrates it, decomposes into these parts, right, and the RNA is out here now, forms new viruses, okay, and these viruses again get completed with the proteins around, and then they exit the cell, okay, and they multiply basically rampantly, okay. So this is basically the mechanism how it works. And the virus, once in the cell, basically what it does, it prevents the host cell from sending out signals to the immune system, you know, so it basically cuts the phone line, the 911 no longer works, and now it's all by itself and can do its evil work. Encourages the host cell to release the newly created viruses, and then also makes it immune to anything that wants to kill it, right? So the body fights back, of course, you know, it raises the temperature in an effort to kill off the virus, so you get the fever. There's also white blood cells and T cells that try to ingest the infected cells, create antibodies to prevent those virions from infecting the host cells, and also make some chemicals that are toxic for the infected cells. But the problem is, you know, when there's too much of this happens, then this all runs havoc, right? And then this is not anymore helping the body at all. When the fever goes too high, then it kills off other things too that you do need. So it's always a trade-off with these. But these are sort of the defense mechanism the body provides. And really, infection is really a race between the virus and the immune system. The milder the dose, the better, apparently. And the infection is, the location is really crucial. If it's above the vocal cords, it's usually not as severe, but once it goes below it, like to the lungs, then it gets very bad, very poorly. So what really is key is that you have a strong immune system. This is really the key also to data analytics in some sense, actually in some very interesting sense, and we'll talk about this later, because if you have a weak immune system, then you're really at high risk. This is really risk factor number one. Lack of sleep could be one weak immune system, anxiety, stress, worries, and grief. Low vitamin D, like if you don't spend too much time in the sun, you know, excessive alcohol, heavy drinking, poor nutrition, also very important, you know, lack of fruit, veggies, so eat your veggies, fatty diet, missed meals, poor health, poor comorbidities, diseases. They don't have to be respiratory, any diseases really weaken your immune system. Excessive smoking, lack of exercise. So these kind of things make your immune system weak, and then when this virus appears and tries to attack you, you'll be you have much fewer defense mechanisms for this. So the disease itself is the COVID-19, right? The COVID-19 is actually a disease. So this attacks your lungs, which is here. You know, the alveoli, the air sacs are the most important part here. And what happens to these in a healthy air sac, the air can go through and then permeate to this very thin membrane and enter your bloodstream, and then, you know, you get these red blood cells take it up, right? And then everything is healthy. But in a COVID-19 infected lung sac, there is a fluid in here, and there's inflammation around this membrane, and then there's no more oxygen can pass through this, and that's very advanced stage. Then you need these ventilators to break this, right? But then you cannot breathe by yourself anymore, because no air can ever anymore go into your bloodstream. And then if you don't have air in your bloodstream, no energy gets produced there at all, right? So that's very fatal. So the spread of it goes like this. So there's this bat have these viruses all the time, and there's the MERS, the Middle Eastern respiratory syndrome. These ones here, they've been assumed they live in camels, and they continue to go to the humans down there. But it's not as aggressive of a virus. The MERS virus is not as aggressive. It keeps coming, right? This is actually 50 years ago already. And then here, this is another one that is really the more aggressive one. Lives in these cats, right? The pangolin, for example, and very rarely can it go to the human. But when it goes, it's very, very dangerous, and it is very contagious, and like it can spread very easily, which we see now, right? Actually, that's what we know. So basically, the second risk factor is really human-human contact, right? If you have this virus and you meet other humans and you cough at them or even just breathe at them, then they get the virus too, and it multiplies with this terrible mechanism that I showed you. And then if you have a weak immune system, you're an easy target. So that's really where it all comes together. So 2 risk factors: 1, weak immune system; 2, human-human contact. Those are the 2 decisive risk factors that can make you sick. And of course, people nowadays travel a lot, and they really easily can wander around. And since it's so contagious, you can carry it in the airplane, and you can go to another country and infect people there. And it just has easy do with everybody on this earth. And this is like just a map that I found that shows the global travel around the world, and see how easy it is. Early timeline, then December 8th was the first case, apparently in this wholesale seafood market in Wuhan. 1 month later, the novel virus was actually identified. 1 month later, the World Health Organization declares it a public health emergency. And 1 month later was the first death in US. Okay, and then not soon after, actually it happened really, really viciously in New York City, where I actually live, or in New York State. And Governor Cuomo declared a state of emergency very soon after the first death, just like 7 days after. Okay, and then we had this containment area in New Rochelle, which is just north of New York City, where it really got rampant a lot, right? So basically, this is sort of the timeline where it happened. March 10 was really New York City was really hit by this, and so there was a lot of interesting talk how to convince people to flatten the curve, how to stay, basically try to minimize the human-human contact, right? Minimize it by various ways, for example, quarantining or moderate distancing or extensive distancing. So really what this is, this blue area here, the healthy people, these are the infected people here, the brown ones, and the purple ones are the ones that the people that have either have recovered from the virus or have disease, sadly. And this basically shows you a little bit how the distancing help flatten the curve. Because if this free for all, basically what happens then, the hospital is flooded with patients and they can't deal with it, right? And here can deal much better with it. So what I really liked about was these videos that Harry Stevens put out, and they were published in the Washington Post. I'll show you a little bit of a video here that I found on YouTube. So what really happens here, when it's free for all, then essentially this simulation here, this brown dot is an infected person, and these blue dots are the ones that are healthy, and they get really infected really rapidly, and you can see how fast these brown dots can overtake the system, and a few of them will recover, but the health system is overwhelmed by this, right, because this is out of control. The second one is this one here, attempted quarantine. So you can do quarantining. The left-hand side is these ones that are in quarantine. The right-hand side are the ones freely moving. But quarantine, it has holes, right? So sometimes a virus can go out. The person infected with the virus can go out and then starts infecting other people. More and more go out, and then it becomes like a rampant one again, right? Actually, reinfections is the second peak can evolve, right? So it's also not that great, right? Especially because their second peak can evolve after that when people go out of the quarantining. This moderate distancing basically is very impressive visualization, I think, like where you basically lock down people. They can't move. This is like moderate distancing, so they can't move, and other people that move have a less chance to meet them or encounter them, and then can have less chance to infect them. So you can see the people start recovering without, and then there's a nicer balance between the people that are infected right now and that are still not infected. This is extensive distancing, so there's really even less chance. You see this here on the curve, very flattened, right? So this is a pretty good visualization to inform people what to do, right? I mean, if you don't understand that, then it's pretty hard to not to comply, right? This is pretty simple. And Harry Stevens says it's really simple, but it's very effective. So then there was really amazing visualizations came from this COVID-19. Like there was a lot of very persuasive visualizations to show the impact of this disease and how it spreads around the world. And it really has energized a lot of visualizations to do this. So there's time series, geography-based, comparative, informative, dashboards. Prominent sources were Johns Hopkins and a company named Data Wrapper. New York Times was very prominent, CDC, Center of Disease Control. Many others came out. And this is one that came from Johns Hopkins University. I really like this a lot because it shows basically in different states the progression of the cases, and it labels it. This is data from 122 to 8916, just recently. When it's red, it means it's progressing. When it's green, it's recovering, the rate is going down. And when it's white, it's sort of neutral. And it kind of puts these small multiple displays approximately where the states are. So you can sort of quickly see where you are, and you can look at this graph that your state has, right? So it's a pretty nice visualization that shows information uncluttered in an uncluttered way, but on a geographic background, right? It's pretty nice, you know. So another one is this very famous Johns Hopkins University dashboard that probably everyone has seen, has leaderboards of the countries, leaderboards of US states, deaths and infected, shows you on a map how many people have been infected and how people have died in a visualization. So it's, I mean, this is also, it's a really good data source. You can actually get the data from here, the infected and the death rates and all this other data is a nice source where you can get data from. Another one is here from Next Strain, is the transmission flow chart that shows you basically how the virus has traveled, you know, and what's interesting, the European virus has come to New York City, while from China it has come to the West Coast, right? So you can really see how it came to Europe too, like from China here, went to Europe, and then from Europe went to New York, and then from China directly to the West Coast, right? So you can enter Brazil, also got infected, which also has a big toll right now, right? So it's a really nice visualization. It just tells you the story, right? Tells you what it is, you know, and you can like look at it. Tabular chart, also very nice, like by state, and shows you the new cases over in the line graph, shows you the trends of it, the tests that were conducted, and the percent positive, right? In a nice spreadsheet kind of way, but illustrated with visualizations. I also like this a lot. This is also from Johns Hopkins. Then here, this is very interesting from Next Strain again, which is the genomic epidemiology. Basically, it shows you the different strands, the different mutations of the virus, right? So there's the Asian virus here, and then came the European virus. This is in yellow, in greenish. Then the North American virus has mutated just a little bit. It has received different names, and you can sort of see, you know, how they flourished, you know, over the time. You know, it's also pretty nice. It shows you very impressively how this mutates slightly and what is the different strains of it, right? Where they came from and where they traveled. Okay. Another one is interactive stacked area chart. It's also pretty nice. You can go here and sort of see the newly confirmed COVID-19 cases per day over time, and you can see the different regions of the world. So this red one is India, this USA, this is South America, this is probably Brazil, and you can then click on it, right? You can actually take the mouse, hover over it, and highlight certain regions of this stacked area chart, right? For example, here I highlighted Mexico, and you can sort of see Mexico constant reported cases, but nothing really expanding out, right? The US is constantly really big, and you know, and India is growing much more, right? So it's also very nice visualization. It's interactive. You use it in a web browser, JavaScript. You can just hover with a mouse, and you can learn more about this particular thing, this particular vein here. Then bubble map charts are very popular, right, where you basically have the cases mapped to a circle, and this is on a county basis, so each of these is a county, not a state usually, right, this is a county. So you can see which county has received more deaths, and or which have more confirmed, have been confirmed for tests, and then you can see where the hotspots are really easily. Bubble chart. This I like a lot. This is a small multiple chart because it really allows you to compare different countries in this case, how they progressed in terms of the cases. You can sort of see who is already over the hill, who is experiencing a second wave. Right, U.S. just always plateaued. It's like the only really country here that's never really gone down a lot. Right, there's like a little bit of a dip, but not much. You know, it sort of kept going, while other countries have somewhat recovered. You know, like here, this one has recovered. Some countries are still going. Some countries still go up. Right? You can sort of nicely compare them side by side. Every little box has its own country. You know, you can sort of see that without having these overlapped lines like these ones here. So these are the overlapped timelines. You know, they are basically aligned, which is really nice. They're aligned. Each country is aligned here. Progression line. This is the deaths that have appeared on a 7-day rolling average, and every country is aligned here at the time when they had at least 3 daily deaths. Okay, and then that marked actually the beginning, and then you would follow them. So you can see that China is most ahead because it had the first deaths, right? And Italy is pretty ahead here too because it was also one of the first ones, and then South Korea and US came a little later. Spain and France came a little earlier. UK came a little after US, just briefly. What's really worrying here is the US is, and this is the logarithmic chart, right? So this is, here it's a lot more deaths than here on the bottom, right? So you can see this, US is topping it, they never really went down. And it's surpassing everyone else in the whole world, right? Which is really worrying. Everyone else sort of going down or plateauing out a little bit, but US is keeping the lead. And you know, this chart really shows this very impressively, especially because you logarithmically flatten it down, so you can really get a good overview. If you didn't do this, US would be like in its own latitude, altitude. So this is a nice map that came from New York Times, where this is I think done by, they surveyed people, and that's the chance of 5 people are wearing masks in 5 random encounters for each zip code, and then they summarized it in counties. You'll see basically when it's darker, more people, the likelihood of meeting 5 people wearing masks is higher than if it's brighter, if it's not so dark, right? So you can clearly see that here is a lot of mask wearing, and I live in New York City, and actually, if you don't wear a mask, people look funny at you. You have to wear a mask, right? Here's all New York, down Miami too, in California too, although they still have a lot of deaths, right? New York pretty much has recovered. Then up here, really nobody, right? In Mississippi, Georgia, much fewer people wear masks, which is you know, not good, but they just don't do it. But this is really nice map to really show you with one view what's happening, right? Who is compliant to the mask wearing, who is not compliant to the mask wearing. So from information narration, right? So overall purpose of this visualization really is inform, right? They need to inform, but can they really tell stories, right? You want to tell a story. Well, for example, readers might have questions like, do I need to be afraid? Or what do I need to do now? Right? These things don't really answer that, right? They don't really give you this kind of advice. They just show you the data in a nice way, nicely, but it doesn't really give you a good narration what it actually means to you. You have to draw these own conclusions on your own. So the question is, can we produce visualizations that are more narrative, right? The key is really to do targeted data analytics and AI, right? And then make this AI explainable via visualization. So AI, so basically we say AI is good, but explainable AI is better, right? You have to actually data analytics is fine, but you have to actually make it explainable. Otherwise people don't really know what it means. So explainable AI approach and software action that we have created discovers interesting patterns in the data, which is the AI part, artificial intelligence part, and then explains this pattern in the native language of the domain. and generates simple narratives requiring just a few data features, which is the explainable AI part, right? It's just a few data features you need, and you can sort of learn about your data, about these particular patterns. Okay, so it's easy to understand. So what you get from this, you get a better understanding of these processes that are hidden behind, that you don't really see when you just look at line charts and so on. You get a trustable AI model because it's explained, can help you make decisions, and it gives you basically a set of knowledge facets told in the domain's native language. It's really knowledge that we capture and then explain it in the domain, in the attributes language, right? Which is easy to understand. So basically, what really a pattern is, it's a subpopulation in the high dimensional feature space. So in this case, we have 500 dimensionals, 500 features. And the first condition is that the data items must be similar in a set of relevant features. They must be similar in a set of relevant features. We'll talk a lot about this soon. And the condition 2, data items have on average unusually high or low values in some chosen target variable. So here in this case, COVID-19 death rate. Could also be COVID-19 infections, or could be returns on stock. It doesn't really matter what it is. You need to have some variable that governs your target, right? And you want to have it unusually high or you're unusually low, because then these patterns are interesting, right? If they're just average, who cares, right? But when they're unusually high, then you want to pay attention, okay? So let's talk about this concept as applied to COVID-19. So the goals here basically are determine why some US counties experience higher death rate. You want to know why that is and gain a better understanding how this pandemic even can happen, right? And what actually encourages it, right? Then assist local authorities to predict where the future COVID-19 death rates might be, in what county, and inform health policy on important correlations. Like, correlations really drive a lot of data analytics. You really want to see things are correlating with something, right? Then you can really see trends, and you can fight it too if you can. Help with allocation of resources, testing kits, medical supplies, and so on. And then aid targeted community-based information campaigns, right? That you actually can inform the community, hunker down, but explain why they need to hunker down. Okay, so we used a large data set, 500 attributes of 3,008 US counties, and we got these attributes are really just demographics, economics, infrastructures, vulnerabilities. Many of these were obtained from the CDC, which measure the vulnerabilities of a region. And then the only thing that we really updated was COVID-19 statistics, because they changed at the regular time. And you can get this data set from Kaggle, actually. That's where we got it. There's lots of stakeholders that can benefit. Government healthcare agencies can benefit. Community leaders can benefit. Healthcare providers can benefit. Industry suppliers can benefit. They can supply chain. They can drive production. Life insurance can benefit. They can inform actuarial analyses and forecast risk and demand, like which county is more prone to COVID-19 death rate. You may want to, think about this or not. And residents that live there gives them concrete information that they can behave in a certain way, right? And that's basically much more informative than someone telling you in a meme that you don't have to worry, right? This is actual data derived, information derived from data, right? This is not this information. This is the real thing, right? So don't have to believe some guy who puts a meme and tells you not to worry, right? So explainable AI basically teaches people understanding of a possible complex subject, can achieve a better compliance, hopefully, and buy-in, because it's explained in regular terms that everyone can understand, and measures otherwise perceived drastic, measures that are perceived drastic, like maybe an easier sell, maybe not, I don't know, I haven't tested that hypothesis. So findings, we found about 300 patterns, which are sets of counties in May. We did this first in May, beginning of May, and then found most of them were higher than US average COVID-19 death rates. That's what our target was. And usually these patterns were described by 2 to 3 features, okay? 297 patterns we found. And they actually still apply now, even in July, or August, they still apply now. So let's see a few examples, okay? So this is basically what our program or what our software produces. This is not something we would maybe show the general public, but this is like essentially the outcome of this data analysis, okay? So basically what we have here, this is like one example pattern. I call it pattern example one. And it's made out of 3 features. I'll give you a little bit of a look ahead, right? So the first feature our program found, fully automatically, it just goes out, it just hunts for these patterns and finds them. It expands out the attributes as it needs. So this first pattern here, each of these purple coins is essentially a county. And this dotted line here that you see here is the US death average, like the death average over all the US counties, all 3,008. Actually, only the ones that had at least one death rate. That's a death count. Okay, only the counties that have at least one death count in May are shown here. Not all the 3,008. I think it's a little bit over 1,000. And then the death rate that for this particular pattern is here. That's the average death rate of this particular pattern. Okay. So this is higher than the US average. That's why it's interesting, right? This is why this pattern is interesting. You can over up here you can see two counties that have way high average that have a way high death rate already. COVID-19 death rate. Death rate is defined basically by the number of deaths divided by 100K population. That is the death rate. Okay, so it's basically the deaths per population size. And you'll see here the purple counties actually are counties that are not really within this pattern. Only the yellow counties are within this pattern. So since there's still some purple patterns in what I call the box of high risk, so you see the box of high risk is defined by poverty rate of the county must be greater than 22%. These are the counties that have a higher poverty rate. Okay, and then this is the next one. This is the next attribute. So now the program says, okay, there's still some, we need to refine these constraints. We need to find another attribute that constrains this hyperbox. Okay, and this probably the program found percent population aged over 65. Okay, and it's essentially the counties that are older, right, where the population is age of 65 is higher. Okay, so then we always, these are only the counties captured in this box, right? These ones are already out, they're already called away, right? Only these counties remain. And now further separation from inside and outside, so we still have some purple ones, but fewer than before. And this is basically the 2 counties are still here, where the counties where the death rate was pretty high. But we're still not done because still some purple points are seen here in this projection. So we have to refine some more, and we refine it like this. Program finds out population density is another attribute that constrains it, right? So for sparsely populated counties are basically here. So we'll basically, in this box here, essentially all the counties that have a population density, low population density, aging counties with high poverty rate. Those basically are the counties that are in this box of high risk, that have a death rate. COVID-19 death rate is higher than the US average. Okay, so where are these counties? Of course, we can plot them on a map, and these are the counties where they are on that US map. So mostly in the south. That's where these sparsely populated counties mostly are, where the population is poor and aging. These 3 things have to be fulfilled at the same time. One of them is not enough. Sparsely populated is not enough a constraint. They have to also be poor and aging. And that makes sense, right? So sparsely populated people, they have a lot of social distancing when they live at home, but when they meet together, they want to meet people. They don't usually put the mask on, or they don't social distance at all because they're so happy to see each other, right? And then they pass away the virus. They're poor. Mostly they have probably low-end jobs, have to work maybe 2 or 3 jobs, or 1 or 2 jobs, and then they have to go out to do this job. They don't have an cozy internet connection where they can just do things at home. They're aging, they're all more vulnerable already, right? Because age is a vulnerability factor. And so you can easily see that. That's why they have, this. Another pattern is here, percent insufficient sleep. It's also very interesting. So when people don't get a lot of sleep, they are more prone to contract the COVID-19 disease, right? And I told you before, right? Sleep deprivedness was a risk factor, right? So this is basically now shown here in this pattern. So so still some purple points. So we have to refine it more. So we'll go here and say the percent uninsured. Only the insufficiently sleeping counties are here, right? So this is the percent uninsured. So these ones, there were counties that where a higher percentage of residents are not uninsured, were not health insured, they have a higher likelihood of dying from COVID-19. Still not enough, still some purple points left, so we'll have to refine it some more and then have to go out and say, well, we found another attribute that really closes the deal, which is the percent without high school diplomas. Okay, so this finishes the deal, and these counties are again in the south. Some of them could be the same counties that I showed you before, but they're also in the south. So these are now the sleep-deprived counties where many residents are sleep-deprived, low-educated, and uninsured. Uninsured is the most decisive one, but all three have to be met, have to be sleep-deprived, have to be low-educated, and have to be uninsured at a higher than usual level, right? And that really tells you this, where you're more prone to contract COVID-19, right? Uninsured, don't have a doctor around that can diagnose you. Low-educated, you ignore a lot of the science that goes with it. I don't know, I don't really know this, but I guess. Sleep deprived is a clear risk factor. People work more than 1 and 2 jobs. They have to travel a lot to the job. They're very hard working. I'm not debating that, but they don't get enough sleep. And then they have higher vulnerability when the virus hits them. They may die from it, right? So that's just what it happens. Then the third one is here. Another one that we found was percent Asian. So this is a very slim box here, So counties that have a very few Asians living there are more prone, but this is not enough. So we have to refine it some more. Percent minority has to be high, right? So there's a lot more minorities in these counties. The third one is percent of black children who live in poverty. Okay, so this is basically another three feature risk factor. And there again in the south, a little more here in the Alabama, Mississippi area and Louisiana area, right? And basically low percent Asian. I think maybe low percent Asian means when you have more Asians living there, they probably know a little more about infectious diseases and they wear the mask. They know more about mask wearing because they know this from Asia. Minority means they're maybe poorer, and the poor black people also are here, right? So it points a little bit at poverty, but it's more concrete about it, right? It's not just enough to be poor. Have to be this particular kind of poverty. You have to be a minority, and the poor black youth population has to be there. Then you get, like the poor black youth population could be, they go out a lot and play with their friends, and then they get the COVID-19 virus that way, right? So it just happens, right? But they may look to you like over-engineered these feature vectors, but this is a very complex data space, right? It's 500 dimensions, and you have to really narrow down and identify these patterns, which we do automatically and exhaustively with a lot of pruning. So we make it efficient. Actually, it doesn't take much time to find them, but because our software is pretty efficient and optimized to find these patterns. But these are very concrete things, and when you fulfill these kind of criteria, you are more prone to catch that virus, right? These are all the patterns we found in May 10. These are only the counties that have at least one death in May. So when you look at the maps nowadays that show you where are the most stricken counties or most stricken areas in the United States, this matches this really, really well. But we found this already in May or even earlier. I think we already had that in April, late April. But this is the May map we had, right? And when a county is darker, it just means it's part of more patterns, okay? So when it's part of more patterns, then the risk is even higher, right? There's a lot more things that can contribute to a risk, right? If you're only part of one pattern, like up here in Montana, well, maybe it's not that bad. But if you're part of many, many different risk patterns, then it's pretty serious, right? Pretty serious. And then that's really what it means. So another one is here, correlation. Correlation is really important because it can really give you some advice on associations of variables, that how they relate to one another. For example, exercise and the state of one's health, right? So if you make more exercise, you tend to be healthier, But what's really the problem is correlations are often hidden with conventional correlation analysis that uses all data points at the same time. So for example, here, is one of those correlations. If you try to correlate severe housing cost burden with COVID-19 death rate, you're not going to see much correlation here. It just looks like a big blob, right? There's no correlation. The correlation factor, actually, coefficient is only 0.1, which is negligible, right? So you may think that severe housing cost burden doesn't really have an effect on COVID-19 death rate, but you can't say that because you have to drill in, right? You have to actually go and go do pattern mining and identify those particular counties that have certain features that actually do have a correlation between housing death burden. So you basically, in this case, we found counties where automatically found these counties that have a low poverty rate, which is measured by this EPL index, and have a high home ownership, 71% home ownership. Those counties are actually have a very high correlation, like 0.62, moderate, okay, moderate. Severe housing cost burden is moderately correlated with the COVID-19 death rate. You can explain this actually. You can say when you know, these are all, this is basically reflective of like the back in 2009, right, when we had this housing crisis, right? There are lots of people that live in these houses, they live in these rich counties, but they have this house, but they can't really afford it. So they have a lot of house burden, right? They have a lot of housing debt. When they have high housing debt, they can't afford lots of things, right? They can't afford healthy food. They can't afford exercise. They can't afford health insurance possibly, right? There's lots of things they can't afford. And then the immune system goes down. They may have to work 2 jobs. Then they have more human contact, and that just exposes them to more risk of COVID-19 death rate, to contracting the virus and then eventually dying from it, right? So there's a clear relation. You can explain this by looking at these factors, very easily explained, right? Clearly a correlation, 0.62. And these counties are here. So this is, other than the southern counties that I showed you before, these are like up here in the East Coast, and also around the big lakes. These are pretty affluent counties. There's like Suffolk County and Nassau County. There's Westchester, Rockland, Jersey. These are all pretty affluent counties. Michigan, you know, they all have the same symptom. There are some people living there. They can't really afford to live there, but they live anyway. They buy the big house, but they can't really afford it. Then they have to really struggle a lot. Then the immune system is weakened. So, you know, you can look at this, right? So, you know, so this is really revealing. So when Governor Cuomo told us back then when the epidemic was raging in New York City, he said, "Look at us, we are your future." He said that multiple times, many days. He said that, and the disease was raging in New York State. They could have, these other counties had not been touched yet. They could have learned from it, right? They could have said, "Oh, you know, I fit the same patterns than New York City or Westchester." Like New York City is actually a very different case, but Westchester, Rockland, and Jersey, they all have very similar patterns in this term than Michigan and so on. Right? That these counties could have looked at them and see, well, we fit very similar pattern. We may be hit next, right? So that's very important, right? So this pattern analysis can give some advice in here also. So another one we found, correlated pattern. There's more of them. I just show you only 2 here. Is percent unemployment versus COVID-19 death rate. Okay, so we'll see, you know, there's not a lot of correlation here. It's like 0.13. So, you know, you may dismiss it and say, well, unemployment doesn't really matter, right? No matter how employed, if you're less employed or more employed, it doesn't matter. The COVID-19 death rate is not going to be driven by that. But if you hone in, if you actually find, if you restrict your pattern analysis, if you restrict your correlation to particular subsets of counties, like a subpopulation of counties, you'll see there's a correlation here, 0.55. Right? Percent unemployment is positive correlated with the COVID-19 death rate, but only for counties where the percent of home ownership is low, where the motor vehicle accident mortality rate of black residents is high, and the vaccination for Hispanics is high. Basically, this is just code. You know, these last 2 ones are code. Actually, all 3 of them are code for urban places, right? They live in apartments. There's a lot of cultural diversity, you know, and so they work in different kinds of jobs. There's a lot less social distancing. They have this you know, they have this vulnerability. They must meet other people because they have a job and they have to deliver things and they have to, you know, meet each other for support, right? They can't just sit at home with an internet connection, right? So that's just a consequence of that, right? and you can see where they are in a different place than they were before. Nassau County in Suffolk is still there, but now the South is also affected by that kind of pattern, right? There's also Southern County that have the same pattern. So you can, again, these guys could have learned from these guys, right? Because here it has hit much earlier than here, you know. So basically what it does, it helps you with prediction. You can plan for test kits, you can allocate hospital care, you can plan for supplies, you can mitigation strategies, you can plan them, you can alert the community you're doing this. And really what's really important is the mitigation measures, because you can now really, you know, you can use these kind of things and predict like what mitigation measures may work better. Like there could be different levels of cleaning, disinfections, or different levels of protective gear, or different levels of enforcement of social distancing. This can go on a continuous scale. You can just lock down everybody, or just tell them, okay, nobody can go inside a restaurant, or only 10 people can go inside a restaurant, or school has to be closed, or only school can attend it only on odd days, right? These are different levels of social distancing. They may fit some communities, they may not fit other communities. So you can just observe counties as they do that and learn from that. I'm going to get to this in a second. So to show you some simulation, right? You really want to know like the future. You want to predict the future. You want to see what will work for me, what will not work for me, and how can I behave, right? So most popular are mechanistic simulation models. These are these compartment models called SEIR, which is most fitting. So essentially there's 4 compartments: susceptible population, exposed population, infected, and recovered, all dead, okay? And these are all governed by these differential equations, and they all have constants within, right? So basically there's a flux of things, right? These guys, the rate goes here, another rate goes here, another rate goes here, and then there's some constant that govern that flow, okay? And that is very, but unfortunately the infectious compartment, when people are infected, unfortunately 4 to 5 or 6 days, you don't know that you're infected, right? There's this, and you can go around and walk around and infect other people, right? You don't know it. And that's really the critical part about this virus, because there's this you know, you're basically in stealth mode for a while and you don't even know that you're dangerous, right? And then so on. This is really problematic. But anyway, with this sort of mechanistic model, you can simulate the effect of mitigation measures. You can say, okay, if I lower the number of infected people by social distancing, or if I lower the number of exposed people by social distancing, or what else I can do, how will my curve flatten, right? I can basically now look at these factors and say, you know, susceptible, here if I do social distancing, here this is the dotted one, and if I don't do any social distancing, this is the flat one, right? And I can also see infected and exposed, right? I can start playing these games and the simulations, and this is very common, right? You can see these models everywhere, right? There's a ton of these models. There's a lot of work done on finding the constants. There's a lot of work done on how to run the models, you know. And then downsides, however, there's some downsides with this, you know. You don't really know much, you still don't know a lot about the spreading dynamics of these viruses, right? You don't really know exactly how it spreads. You know a little bit, every day you meet something else in the news, right? And all of a sudden you find out that you can be infected again. The next time you read, you can't be infected again, right? And then the children have more infections or less infections. But nobody knows, right? Every day someone else writes a paper. Actually, almost 100,000 papers have been written about this, on all kinds of issues with the COVID-19. It's amazing how much research has been done, and they're not all conclusive, right? Everyone has different data and they measure different things. So it's not clear really what is it, right? So you don't know the size of the susceptible community. You don't really know who actually has been infected right now, you know, and then you don't know how long it takes until it's infectious, and then you also don't know the disease reproduction rate, how many people get infected per case. And it's also at the measure of age, right? Some, you know, and then there's a lot of things you don't know. And the persistence of immunity, you don't even know that, right? So this actually, one paper I found showed that it can be very sensitive to small changes in assumptions. So for example, you know, 10% in this R0, which is this new people infected per case, say from 2.3 to 2.5, can lead to an 80% increase in the predicted number of people infected. 80%. It's almost double, right? So just by a small increase. So this is how sensitive this all is, right? You have to keep updating all the time, all the time. So it's not exact science at all. There's all statistical models. I'm not saying it's bad, I mean, there was a very skeptical paper, but in the end, it's all you got. You have to work with something, right? So that, this is better than nothing, right? I'm not saying this is bad. I'm just saying be cautious about interpreting these results. So in standard linear regression models, of course, are there too. You just compute the dependence of certain factors, standard linear regression, and then control for others by including those two, right? And then you can also do this mixed effects nonlinear regression model, which is very famous, the IMHE model from University of Washington, which was very early on. It was amazing. White House actually adopted it, and in the beginning they were somewhat wrong, but they have caught up. And they basically fit the curve to prior data. Okay, project out what happens. So they look at China, Spain, Italy, and then predict what may happen in the US. Okay, learn from data and predict and fit the curve to it with this non-linear regression model. Okay, so then you can also measure, like some states have, some countries have enacted different mitigation strategies, and then you can basically, see what happens to your own state if it's sort of similar to whatever country that is. So it's not a bad thing. So this is the kind of curves they put out. You can see like this is today, and then you can say this is the projected, and if you ease it out, the deaths grow much more, and if you wear a mask, the deaths grow much less, right? So you can sort of simulate now with these models, you can simulate what will happen, and you can also project like hospital resources, right? You can project how many beds you will need, how many ICU you will need, how many ventilators you will need. But you can sort of see it fluctuates, right? Because there is uncertainty in this, right? You can never concretely exactly plan for it because there's so much uncertainty, because nobody is exactly like you, right? It all depends on similarity. How much really does this other data fit your particular case, right? So similarity is really important to really compare apples and apples, right? And you can never find the exact apple. You may find a Granny Smith apple, but you need a Golden Delicious, right? So there's never, this can, or even worse, right? There can be a pear and an apple. So basically, the predictions become less faithful. But it's a good method. It gives you a little bit of a trend, right? And then, but there's, you can't perfectly plan out for the exact number of beds that you need. So statistical models, to compare them with simulation, statistical model, they don't really account for how the transmission occurs. It's all about statistics, measuring, fitting, and so on. And it's all grounded in data, on basically capitalizes on what you know of the past. And then you try to project it out into the future. Okay. So, of course, it becomes more accurate as more data become available. So this is really data-driven, right? If you have more data, you can do better, of course. The simulation models, on the other hand, they're not really that much data-driven, but they have a good model. And of course, the parameters are tuned by the data, but they have difficulty in estimating these parameters. Again, if you don't have enough knowledge about the underlying system, then you can't really estimate these parameters as well, right? But they have a longer horizon usually, because once you set up a model, you can predict even a year or two out. Certain caution, of course, but they're more long-term predictions than the statistical models. And really what they do is they explore what could happen, given different future conditions, okay? So it's like the other one is the statistical model more about what has happened, and the simulation model, what could happen, right? It's a simulation of the process, to some extent, right? And this is actually really useful before much data is available, right? Because you can simulate, it's kind of like simulated just setting parameters, you can already simulate. You don't need any data, right? Just a guess what the good parameter might be. And you can tune it by observing what really has happened and iteratively improve it, and that's what they actually do. So how can we fit in here, right? So we have these patterns that we find, right? So we have a data-driven, data science type of approach, right? It's not so, there's statistics in it to figure out what these patterns really are. There's robustness measures and effect size measures and so on, but it's more a data-driven approach, okay? So patterns we find are essentially predictions, right? Because remember, they were on average, these counties had on average a higher COVID-19 death rate than the US average, on average. But there were also counties that didn't have yet, right? That I don't show them here, but there are even counties even below that, right? Haven't had any deaths so far, right? And they should be careful, right? And we've seen this, that some counties here over time, this is from May, have gone up here and have increased of course, the US average went up too, but this average has also gone up, right? Some counties down here actually have gone up, right? So in that sense, it's a prediction, right? Because once you're captured in this box of high risk, you have a high chance to be infected, right? So I made some more plots that can show you this, okay? So we automatically invented 297 patterns, and we found out that we in May 10 we then used the May 10 patterns and used the June 10 data that the COVID-19 death statistic from June 10 to see how our patterns were really able to predict the death rate average increase, right? So in the US county-wise death rate average was 24.1 deaths per 100K population. This was up from 16.8. Okay, this was the US-wide, okay, increase of 7.3. What we did, 98% of our patterns grew 2 to 3 times more than the US average, or 2 to 3 times more than US average. Okay, the others, the remaining 2%, they grew at the US county-wise average. So no pattern actually went down. Okay, so basically, when you're in this box, you could expect, the probability was high that you would have a higher death rate than the US on average would have, right? If you were a stock, then you could sort of say, if my portfolio is in this box, then you could say that that my stock will probably grow much more than the index, right? Stuff like this, you can say. So this was very, and this actually we confirmed this with July 10. So let's look at this a little more, right? So here's the US average, okay, US average growth from May to June, and this pattern number 1 that I showed you, pattern number 2 that I showed you, and pattern number 3 that I showed you, much higher, right? 2 to 3 times higher the US average. This is the growth, the death rate growth, right? US average grew at, and it's at the 7.8, and then this grew much more, or 7.3, and this grew much more, 3 times more. And this is June. This is from June to July. This is from June to July again. Pattern 1, 2, and 3 grow more than US average grew in this time interval. But now it's interesting, pattern 2 grew a lot more. Pattern 2 here from May to June was a little bit lagging behind, but now from June to July it really caught on, right? So it's basically catching up, right? So those really are predictive, right? That it's like you may think pattern 2 is not really that predictive, but it just took a little more time to reach it, right? It had counties that hadn't been affected yet that much in June, but then really got going in July, right? It's a sad thing, but it's just what it is. And really, when you look at it, and this visualization can show this even better. So here, this is a little bit harder to look to understand what's happening here. So basically, what I did was this line here is the US average. Okay, I adjusted the death rate by US average, and this blue line here is the May 2020. So these are the different county ID for pattern number 2. There were a little bit over 103 patterns in there. 103 counties were in this pattern. This is pattern number 1. 103 counties, and I ordered them by the May death rate. Okay, so from left to right, the death rate was up, right? And then this is the May death rate minus the US average. Okay, this is like minus the US average. So this is so whenever something is higher, then it's higher than the US average. And then I plotted these red ones are the same count as in June. Okay, minus the death rate that was in June. Okay, the US average in June, right? So you can see there's quite a few of them. It's just explosively grew. Many of them explosively grew. Almost none of them went below the May one, right? The adjusted May, but many of them explosively grew up, right? So that's why you have 2 to 3 times more average than the US, right? Same thing for pattern number 2, a little less. Remember, like it was a little less growth in June from May to June. So this shows here some actually went below the US average. Now they recovered, okay, and some of them explosively grew up. And then this is the pattern 3. Again, most of them grew pretty high above the May rate. Okay, some of them went down, but really most of them grew, right? So it was a predictor. And you can see this here. This is just the growth rate ordered by the rate itself, right? And you can just see there's a lot of them explosive growth, and only a few actually went down. This is for the 3rd one. So when you look at these maps here, you can actually see this very nicely. So this is the map May 10. This is the map June 10 for pattern number 1. And when you look at it, this guy here, this county here wasn't even visible yet, right? Didn't have any deaths, but now has deaths. Here in this particular area, there were a few of them, but here a lot more, and they have grown, right? Here in this area, some counties have gotten much darker than they were in May, right? So that's clearly a growth. It kind of looks like rust on a car over time. You know, it starts like getting painted by this. The pattern number 2, just like that too, not as severe, but also severe. Here, this area, some new counties have emerged as high death rate. Here, also in this area here. Another one is here, this pattern number 3 that I showed you, right? You can see there's a lot more activity going on in this area, a lot more activity going on in this area, you know, and in June, right? So I didn't make a July map, I didn't make an August map, just to show you that this really, you know, that you can really see that there's clearly growth predicted by these patterns. So what we then constructed is a dashboard where people actually can go and do this by themselves, right? So we don't want people to read endless reports on counties. We want people to explore the data and find things by themselves and make findings and learn by themselves because there's so many patterns and there's so many counties. If you had to write a report about this, it would be very tiring to read. So people can just go with this dashboard. It's not out yet, but will be like in maybe 1 or 2 weeks. This is like a screenshot from a little earlier version that we have, but it'll be out in 2 weeks. And then people can, basically what they can do, they can click on one of the counties and then see here the patterns it participates and can also see what the patterns actually are. And they can also see what other counties, that they can then click on a pattern and see what other counties have the same pattern, right? So they can see their own county and can see other counties that are very similar than your own county, right? So you can learn a little bit about the United States. You can learn about who actually is similar to me, right? Who has very similar factors in terms of this particular pattern, in terms of sleep deprived living, low education and uninsured, right? I can learn about the United States that way, and CDC, for example, could learn about where are these risk factors and where are they also, right? You can learn from counties here, you can see what happens to other counties in other places in the United States, you know, so that's very interesting. So basically we have addressed so far, do I need to be afraid, right? And you can just look at your county if it fits one of the risk profiles and you know if you need to be afraid or not. It's of course not a nice thing to say, but you know, better be prepared than not prepared, right? Better safe than sorry. So you know, so it's good to know. I don't want to alarm anybody, right? But these patterns are true patterns, and the death rate matches, right? So you know, don't want to be alarmist, but you know, better safe than sorry. But what we haven't addressed yet is, what do I need to do now, right? What actually do I need to do? Like if you are a county official, how can I protect my citizens, my residents of this county, so they don't die from COVID-19? What can I do? You know, so do I do a complete lockdown? Do I close the bars and restaurants? Keep open but wear masks and follow social distancing? How much routine cleaning should I recommend? How much disinfection do I need to recommend? How much protective gear should I ask people to wear? And then how strongly do I need to enforce social distancing? Do I need to lock down everyone? Do I need to give tickets when people don't, you know? There's all kinds of things that people have done, right? It works for some, it doesn't work for others. So, you know, so what you can do basically is you can learn from the data. You can look, some counties have already done things, right? And other counties have not yet. So you can learn from those counties that have already done things and see if the profile matches yours, right? So first you look at the counties that have done certain mitigation strategies. At this point, almost everybody has done something. And then see, you know, maybe your mitigation hasn't worked and you want to see what can you do that works better. So you just have to look around these counties and do pattern comparison again. Take the mitigation and form patterns just like before, and then compare your own county to certain patterns and then look up what strategy worked for them or if it didn't work, right? And then you can basically learn from that, right? And this is basically what we're doing right now, trying to measure the mitigation strategies, do pattern analysis, do a causal analysis on that, and then give recommendations for what kind of mitigation strategies may work better and what may not work so well, right? So want to thank the sponsors. Like, much of this was financed by National Science Foundation Small Business Innovation Research Grant that was given to my company Kai Kaeru, and also got some supplement from New York State, which I should be thankful for too, the SPR program. Definitely should thank Eric Pappenhausen, who is the other part of this company. It's a small company, you know. It's Eric Pappenhausen is the other part of it, has done a lot of the programming. Darius Coelho, Ayush Kumar, Nikita Gupta, Anush Jain, Kevin McDonald is a professor there at Stony Brook University. The others are intern and students who have worked developing the software. You know, so we have a strong link to the university. And if you're more interested, you can go to our website, archaicaro.com, or you know, we'll have a paper soon on this, which we'll put on the website. And hopefully this was interesting to you, and hopefully it has helped you understand more about COVID-19 and what data science can do to analyze these kinds of this kind of data. And I guess I'm gonna get some questions now in the questions round. Thanks a lot for listening.